My name is Cerquetti, and I'm going to teach some pelvic pain yoga. These are what I consider rescue poses for when we're having a lot of pain in the abdomen, anywhere between here and the knees, including the thighs, the hips, and the back. This whole area can be considered pelvic pain. So first, let's set an intention. The intention today we can set with a few affirmations. We are not solely defined by the pain that we are having. We are not solely defined by our symptoms. We are so much more than that. And this can serve as another tool of management for pelvic pain. We're going to practice Ujjayi breath. It's in through the nose and out through the nose. When you exhale, it's more of an oceanic breath. So you're trying to fog up a mirror by constricting the back of the throat just a little bit. Take a few breaths like this. The breath is always with us, and a lot of times it is the way that we can get back to our baseline by reconnecting with the breath. Feel free whenever sitting like this to sit on a block. It lifts up the pelvis and hips, and it can help with any discomfort that you have in a regular sitting position. For today's practice, we're actually going to start on our backs in one of my favorite rescue poses of all time for pelvic pain. It's a constructive rest pose. So lay down, have your feet as wide as the mat. I know I have a big mat, but if you have a regular mat at home, just make sure it's as wide as the mat. Knock in your knees. Very good. We're going to practice diaphragmatic breathing laying down. So just open, receptive hands right on the abdomen. Breathe in through the belly, so you want to feel the belly lift. So inhale. Exhale. So you're saying belly up and belly down. This is also fantastic for increasing lung capacity, for singing, which I also teach. So it's useful for more than one thing, by far. While we're doing this, I'd like you to picture the pelvic floor as a bowl. When you take that inhale in, we're filling up with air all the way down. Try to connect this breath with the pelvic floor. One more breath here. Good. Now take your knees into your chest. Just take a minute to feel that release. And now take your knees in circles. They can be really big, they can be really small. We're just trying to add movement into some of the stiffer areas. And it's a nice little back massage as well. Now take it in the other direction. Very good. We're going to work on trying to relax these tight pelvic and back muscles through a few yoga asanas. This is one of my favorite. Turn to your side. And like an accordion or a book, we're going to open and then close on the other side. And then open, close again. Make it follow the breath. Inhale, closing on the exhale. Inhale, closing on the exhale. A few more of these. Inhale, Exhale. Inhale. And exhale. 2 more. Inhale. Exhale. Inhale. Exhale. We're going to slowly get up from this position. We're going to find ourselves in a tabletop. Take your time getting there. Once here, you want to make sure that your shoulders, elbows, wrists, all in line with each other. For more space in the spine, you can tuck the toes, or you can leave them flat. It's a little more traditional. Either way is fine. Whenever you're on your hands like this, you want to make sure that the L part, the thumb and the forefinger, you want to make sure they're nice on the floor. If there's any wrist sensitivity, you can either use the yoga wedges, or you could elevate your wrists on blocks just to make that angle a little less sharp. This one right here. Once you're in a nice tabletop, we're going to do some cat-cow, and then we're going to do some freestyle cat-cow. So inhale, look at your navel, become a cat. Exhale, bottom up to the sky and gaze up to the sky with the arch in the back. Inhale, look at your belly. Exhale, cow, look up, back bend. One more like this. Inhale, look at the navel. Exhale, look up. Now we're going to do free-form cat and cow. And this is okay, nobody's watching. I want everybody to do their own style, do what your body feels. We're just going to do some nice shoulder and hip rolls. And again, this is free-form. So this brings some creativity and playfulness to the mat. And now from here, just wag your tail. A long time ago, we once had a tail. We're going to act like we have one again. So take control of the tail and just wag it around. We're just bringing movement, circulation into the hip, into the pelvis. Couple more like this. Good, and now we're going to go between child's pose to tabletop. Back to child's pose. Tabletop. Child's pose. Tabletop. One more. Child's pose. Tabletop. Very good. From here, we're going to tuck our toes under. We're going to first come into classical downward facing dog. It's okay if your feet don't reach the floor. I want you to pedal your legs. We call it walking the dog. You want to make sure you're applying equal weight on your hands and your feet. You want it nicely distributed. Keep in mind to keep your fingers on the ground, and again, that L shape, push into there more so you don't strain your wrists. Once you feel a little bit warmed up, there is never a reason to overstretch the hamstrings. So what we want to do also for the pelvic floor, bend your knees a little bit, send your bottom up into the air. By bending the knees in these kind of forward bending poses, including downward dog, standing forward bend, and so on, bending the knees is always a good idea so we're not straining our hamstrings, which can end up being referred pain to the pelvis if the hamstrings are tight. So it's important to remember that. And then you can wag the tail around a little bit again. Very good. Now from here, we're going to take our left foot forward. You can even bring it, if you can't make it all the way, take it with you. Good. Now put your hands on the inside of that left foot. And I want you to put that back knee down. If there's any sensitivity, you can always move a blanket, a little rolled blanket just for some padding. Now this is lizard. It's really nice to open the hips, and while we're here, you could even be on a block here. If this is a little too much, you can always elevate. And what this does is, it's a nice hip opener. but it's also stretching the psoas muscle, which goes all the way from the end of our thoracic spine, and it connects to the femur. So it's pretty long, usually kind of ignored muscle, but it's a huge part of what we're experiencing here. This is a great stretch for the psoas. You just want to breathe here. Breathe into the places that need the air. While you're here, you want to make sure that your knee is not going past your toes because we want to avoid any sort of knee injury. If you do have room, you can always feel free to go down like this. Just be careful to never strain. There's no reason to strain. This is for symptom management and pain management, so we never want to strain. This is part of your medicine, as I say to my patients. Very good. Now from here, we're flipping back into downward dog. Remember to, once you're there, bend your knees a little bit and just send the bottom up higher. This helps take that pressure off like we were talking about. This time, because everything is both sides in yoga, always, we're going to take the right leg forward. Do the same thing. Lizard on the other side. So remember, you want that knee and ankle stacked as much as you can. Feel free to grab a block. You can stay upright here. You can also put your arms on the block. You can do a hand mudra here. Mudras are hand gestures with healing properties often practiced with our poses. You can do Anjali mudra here, just prayer hands. And the gaze should float in front of you, and just again breathe into where you need it. It might be this psoas muscle. You might want to breathe into this hip. No matter what, make sure this knee is hugging in. A few more breaths here. Very good. Come back up. And from here, moving back through downward dog. Walk it off. Remember to distribute that weight and feel what we just did in both sides of the body. We have to rebalance that out. Remember to bend your knees a little bit. Good. From here, we're going to come to our knees in a nice wide, extended child's pose. Put your forehead down on the ground. If that's too much, you can always put a block here. Sometimes it just feels good to have a little extra support for our forehead. It's where our third eye is. It's where all our concentration lies. Sometimes we just got to support it. Breathe here. If there's ever any trouble in extended child's pose, we can always roll up a blanket or a bolster. Some bolsters are really big and it's a little challenging. You can always put it behind here if you're having trouble having the hips meet the feet. And so that looks like this when it's pretty propped out. And just breathe here. To come back up, There's a fun pose I really love because it's a chest opener. It kind of sneaks up on us. It's puppy. And puppy pose is similar to child's, but you want to be in a tabletop. This is stacked over this. And you want to just reach out like a puppy. Breathe here. Very good. Push back up into tabletop. Come to a comfortable seat. We're going to work on Baddha Konasana. That's bound angle pose. So what you want to do is touch the soles of your feet together. I always like wearing leg warmers because it warms up the muscles in the legs. It's just a rapid fire process to get into the deep stretches of yoga. Breathe here. You also want to make sure your bottom's not holding you back. So lift up a little bit behind. And it's okay if your knees don't touch the floor. A lot of times what I'll recommend here is taking 2 blocks, 2 textbooks, anything that looks like this that is stable, and you just stick them here so you don't have to worry or feel the strain of the knee trying to come to the ground. Try to straighten that spine and do some diaphragmatic breathing here. Once we've straightened the spine, feel free to fold forward if you have the space. You can also take a bolster here or another block if you can't make it all the way down. And you can relax here. Again, we need some support for the forehead sometimes. With control, inhale, fill yourself up with air and slowly come up with it. I'll move this for a second. We're going to come to our backs and do my favorite pose ever in the world for sciatica, piriformis syndrome. If you've had it, you know what that is. Basically, it's any sort of shooting pain down here or shooting pain across here. Is typically one of those things. So what we're going to do is both soles of the feet on the ground, knees bent. We're almost in that constructive rest pose, but we're going to do a reclined pigeon. So pick up the right leg, just knee into chest, just getting that motion in there just a couple times, just to make sure we got the flexibility. And now we're going to turn out and have the right ankle to the left knee. So again, we're just doing pigeon laying on our backs. One of my favorite poses. You're going to pick this up, the left leg, and you're either going to reach under the thigh or you can reach the shin, depending on your flexibility. My favorite part about it being on our backs is that you can control the intensity of the stretch. You should dorsiflex your feet, which is this, not that, that's pointing. This is dorsiflexion. So you want to keep your ankles neutral. And it's a great stretch for the muscles of the hip, the groin, and again, it can really help with piriformis syndrome or many different variants of sciatica. This is a great pose for any time of day, but I always recommend it to patients in the morning and in the evening before they go to bed. It just helps get the fluidity in our hips and pelvis. Deep breathe here. You want your shoulders staying on the ground. You want to use your biceps to pull in. Good. And now release down slowly. Now we're going to take our arms in a T and windshield wipe the legs. There you go. And other side, we're going to take in our left leg in like so. Just get that motion in there just so your hips not being shocked. Here we go. We'll ease into all the poses when it deals with pelvic pain. We store basically all our stress in the pelvis and hips. That is true for almost every human. So these muscles get tight very easily. And over time it becomes chronic, and then it becomes hard and more difficult to treat. But it's never untreatable. We can always come back to this, stretch, listen to our bodies, reconnect our mind to our body. And through the breath, we have another form of control over our symptoms. Breathe here. You might feel some sensation, might be like a little sharp in the piriformis area or the sciatic nerve, as long as it's not acutely painful. Use your breath to feel the stretch sensation. If something's ever acutely painful, come directly out of it and return to either a child's pose or an easy seat and just focus on the breath. Good. Now we're going to lower back down. Very good. We're going to take our arms in a T and windshield wipe the legs, just like we did before. Knees into chest. We're just going to roll up and down the spine a little bit. For those that are warmed up and flexible, feel free to go into plow. Do not look sideways once you're in plow. Just keep looking forward. We do not want to destabilize the neck. Always remember that the neck is an extension of the spine. It's part of our spine. Fold in and out. Just move in a couple different directions in the hip. And from here, there's a couple options. There's regular spinal twist. You can also do cactus arms if you're somewhere with not a lot of room. That's okay too. What you want to do here is you want to have the knees coming into the chest, T arms or cactus arms, either are fine. And you just want to let your knees as a group fall to one side. And you always want to gaze, if you have the flexibility in your spine, gaze in the opposite direction of your knees. If you want a little twist here, an option, which I actually really dig, is to, instead of just taking them up like this, do what I call eagle legs. If you have the flexibility, even if you just cross them once, and then have a block waiting for your knees. So it's a little more of a twist. It's just an extra layer. Sometimes it's called twisted root. Bunch of different names, but it's all the same thing. Breathe here. And again, if this is too much, all you gotta do is remove the block. It's just a variant. Remove the block. Just make sure that your shoulders are on the ground and that your knees are either on the ground or touching a block. Close your eyes here if you feel comfortable and surrender. There are so many things we can't control. And that's not what we should put all our stress on. Let go of all the variables we can't control. And breathe into the stuff that we can control. Inhale. Back up. Now we're going to come to the other side. Drop them down. Twist variation or no. And then look the opposite direction of your legs. And again, you can have cactus arms here. Sometimes in a crowded class, that's a good idea to save room. Or just in a T. Close your eyes and surrender here. Deep breaths. Couple more breaths here as we get ready for constructive rest and Shavasana. Inhale the legs back up. Put them on the ground. Take them wide as your mat, or just slightly wider than your hips if you're on the big floor mat like I am. Knock in the knees. And now there's a back traction variant that I like to practice where you push down on the thighs with both hands. Just push down. You're kind of straightening the spine a little bit. Just a little bit of traction goes a long way. Return to the 2-part breath. It's going to be belly and chest and belly and chest. So inhale. Belly lifts, chest lifts, belly down, chest down. A few more of these at your own pace. Very good. Again, close your eyes and surrender here as we prepare for Shavasana. There are many different options here. One would be to go by the walls and put your legs up. This is good for lymphatic drainage. It's good to just take all the weight out of these muscles and just let them go this way for a bit. This is fine. Or alternatively, you can use a booster. A little bolster pillow here. Sometimes it helps with low back pain to have something under the knees, just lifting it up a little bit. It relieves that funny feeling in the back when we're laying totally flat. If you have an eye pillow, that helps out, or even just like a tiny little weight over the eyes just to bring peace on. You can do cactus arms here. You can rest your arms at your side. Continue to connect with the breath. Melt into the floor. Feel the support of the floor, of the ground, of the earth supporting us. Let go. Rest here in Shavasana as long as you would like. When you're ready, slowly make your way to one side. Once again, realign with the breath, realign with the earth, and reconnect your mind to your body. Slowly make your way into a comfortable seated position. I like to sit on a block. It lifts the hips up, lifts the pelvis up. It makes sitting a bit more comfortable, which is the whole point of yoga, is to sit comfortably so that we can meditate and get in touch with the breath once again. This time, put your hands out. This lends to receptivity. Just breathe here. Bring your hands in prayer to the third eye. Thank yourself for coming to the mat today. It's a big ask, especially when we have pain or any active symptoms. But know that this is a tool, yet another tool in our toolbox to manage this kind of pain. Thank you for coming to the mat with me today. Namaste.